Welcome to our workshop on communication skills. And in this video, we are going to talk about various types of communication. Well, communication, as we all know, is basically imparting or receiving or exchange of information. And we also know that for communication, we do need a medium. Medium is a system or channel through which a speaker or a writer will communicate with it, by speaking or by writing. If we classify it on basis of media, either the communicator is going to use some words, or he may not use any word, and even then he will communicate. When we communicate with the use of words, it's called verbal communication. And when we do not speak or write some word, and even then we are communicating, this is non-verbal communication. So both of these communications, they are very important. They've got their own importance. As you see that verbal communication, it's really the communication which is very important to define a reality, to organize, to think, and to shape the attitudes. Similarly, the verbal communication is to define everything starting from ideas, emotions, experiences, thoughts, objects, and the people. Let's see what non-verbal communication is about. This is some communication which really helps the people to reinforce or modify whatsoever they're saying in the words. And mind you that body language is one of the very important tools of non-verbal communication. We are going to talk, only about types of communication in this very video, and we'll be talking in some separate video regarding the body language and the tools or components of body language itself. So let's see, how do we classify various communications? What are the types of communication? And as I mentioned earlier on, that if we classify it on basis of use of media only, this will be either with the words or without words, and we use verbal or non-verbal. Even in verbal, there are further two classes of communication. One is, oral communication, and other one is written communication. When we speak or listen, these two communications, they are oral communications. We either write the word or we read the word. So in writing, reading and writing both are communications. And in nonverbal communication, there are various tools which are, utilized for this nonverbal communication. The biggest tool here would be facial expressions, gestures. The body language is one of the components of nonverbal communication. Proximity, the touch, the volume and the tone of the voice, that also makes component of my non-verbal communication. Similarly is my attire, my appearance, while I'm communicating with my audience. This also makes an impact. And my eye contact, and mind you, the most important tool, as I said, it's the silence. This was one classification. Let's classify it in another way. It may be vocal, or it may be non-vocal. In verbal communication, we speak or we do not speak. In non-verbal, we make voice. We do not speak word, but we make voice. We may make voice, we may not make voice, and even then, we may communicate. So in non-vocal words, they are utilized to communicate, and there are different forms of words. We may use the sign language. What sign language? See, it's here, various slides of sign language. Similarly, when we have got people around who they cannot speak, they can use their hand, their fingers for spelling. Like, see it here, the upper three lines, specific alphabets, as we are showing here, and the last line, count as well. You can see in this slide. And third one, we have got specific language for them, that's called Braille. And what's Braille? It's like this. We have got raised, dots, and these dots, they form specific patterns, specific words, and these are, this is the language by which, blind people, they can communicate by writing, by reading their the specific books, they are written in the Braille language. So this is all about non-vocal, verbal communication. And similarly, in non-verbal communication, vocal, we may just make voice as is crying or laughing. And in non-verbal, communication, we have told you about communication may be divided into further three types based on, use of media, what media we are using, or based on the direction of flow of the information, or the communication that's taking place at organization level. Let's see a few of them. Media, use of media, we have already mentioned in detail. It may be verbal or it may be non-verbal. Let's see what's the flow of information. The information, the communication may be horizontal with my peers, with my colleagues, with my people around me who are there at my level, or it may be vertical. See some hierarchy, see some office. I may be talking to my boss, I may be talking to my younger colleague, or my juniors, or my subordinates. So this vertical communication, that may be upwards to my boss, that may be downwards to my boss. And as we can see, that both of these communications, they have got their own parameters, and we are going to discuss these parameters. It may be diagonal when we are involving both the horizontal and the vertical segments. It may be diagonal. And then the last type, the organizational communication, it may be internal. When the communication is only in with the colleagues at the organization, or it may be that organization is talking to its clients, to the people whom they are providing the health care. And this is the importance of this communication, that when it's internal, it may be formal or informal, but when I'm going to talk from point of view of the organization, my communication has to be formal. You may ask me that, Dr. Saab, where this falls in our this workshop. Yes, well, if I'm working in hospital, I may be writing call to my colleague department. I may be calling them for their expert opinion. This is the internal communication. I may be taking classes with my doctors. I will be taking classes with my postgrad students. This is the internal communication. But when I'm writing the prescription, no, this is the hospital, no, this is my facility, this is my institute, which is talking to, communicating to the people, to the stakeholders whom we are providing the health care. My prescription, my discharge report, my death certificate, my whatsoever official communication I'm doing with my clients, this is the external communication, and that has to be structured, that has to be very formal. Basically, these are some types of communication that we are going to talk about, that we are going to elaborate, and that we are going to detail in coming these 3 days. Ladies and gentlemen, you are welcome to the workshop on communication skills. Thank you very much for joining us. Thank you.